There is no doubt that preparing for back to school is stressful right now. Whether your kids are taking classes in person or online, you want to make sure that they are safe and healthy. So throughout the morning, we received a lot of your text questions to our 9Health expert, Dr. Payal Kohli. She joins me live now to answer some of them. Good morning, Dr. Kohli. Wanted to get to that first question right away. It's about advice to have when it comes to recess, and what conversations parents should be having with kids.
Good morning, Anusha. So recess is definitely one of those high-risk periods because there's a lot of interaction occurring amongst the kids. So I have two pieces of advice for parents. The first is to talk to the school, see what precautions they're taking. Are they splitting the kids up into cohorts? Are they wiping down, the playground during recess? Are they making sure kids wash their hands after recess? Are they monitoring the children as they play to make sure they're not touching their face? Those types of precautions are critical. The second piece of advice is to actually talk to your child and help them understand why recess is going to look a little different. Some pediatricians have recommended trying to get the child used to the idea of wearing a mask, washing their hands, maintaining distance by making a story or a game out of it. So, for example, you could make it a superhero costume that you have your mask on and you have a force field of 6 feet of space between you and the next child. And then other pediatricians have recommended actually trying to incorporate those routines into your child's playtime at home so that when they're at home, you can monitor how they're wearing the mask, how they're behaving, whether they're doing it correctly or not, and try to educate them.
Oh, that's all very, very interesting advice. And should we limit our children's exposure to their grandparents when they go back to school, even if it is part-time contact?
Yeah, this is a tough one. And unfortunately, the answer is yes. And that's the most conservative thing to do because the science is telling us that kids can be silent spreaders. So greater than 90% of them have mild or no symptoms. So, they could have potentially been exposed to the virus, be carrying it and not showing any symptoms. We've also learned from recent science a couple of other interesting facts. One is that kids under the age of 5 have about 10 to 100 times the viral genetic material in their noses if they become infected as compared to older kids or compared to adults. So the amount of virus that they carry around, even though they have no symptoms, appears to be very high. And then another study out of South Korea that tells us that kids over the age of 10 spread the virus as efficiently as adults. So because they can both catch it, harbor it, and spread it, it's important to maintain that distance from the grandparents. Now, if you really want to see the grandparents, then a safe way to do that would be to get your child tested beforehand.
All right. I know that's one thing that my family's been debating, so appreciate that perspective. That last question we've got is, what about college kids? Should we be worried about our kids moving back on campus, and how do we best prepare them?
Yeah, this is a great question. So college kids is a whole different ballgame because it's not like elementary kids where they don't understand the science, but it's more about emphasizing compliance to them. So making sure that they stick to the rules and also helping them manage their exposures, because that's one of the biggest problems for college kids is they come into contact with a lot of other people. So some things you can tell your college kid to do is try to avoid parties, go to the dining hall at off hours, try not to use the rec center, exercise outdoors. If they're going to live in a dorm, try to choose a room without a roommate so that they're living by themselves. But of course, we know that those things are not always possible, especially in college environments. So I would strongly encourage you to talk to your college kid about testing and getting tested regularly as a way to really manage their risk. So at least once a month, but more often if they've had a potential exposure.
Okay, thank you so much, Dr. Kohli. As always, we appreciate your time.